so let's dive into one together. So our instructions are to complete the diagram by dragging from the choices below to specify what condition the client is most likely experiencing, 2 actions the nurse should take to address the condition, and 2 parameters the nurse should monitor to assess the client's progress. Okay, so let's look at our data tabs first. So we see that we're caring for a 34-week pregnant client, and the nurse reviews the health history and vital signs from 0900. So in our health history, we see a client who's 34 weeks pregnant. She's a G3P2 and is being seen in the obstetrician's office for a routine prenatal appointment. She reports experiencing mild lower abdominal cramping and small amounts of bright pink vaginal spotting yesterday evening. She also notes recent occasional dyspnea, and the client reports a mild headache for the last 2 days and not feeling the baby move very much today. Okay, now let's take a look at our vital signs. So in our vital signs, we see that we have a temperature of 98.2, our pulse is 80, respiratory rate's 20, we have blood pressure of 122/81, our pulse ox is 97%, and the pain is 2 out of 10 for a headache. All right, so we need to recognize our cues. That's going to be our first step. So this is where we're looking at what matters most here. So looking at this information, what things were concerning for you guys? What things did you see? What did we think about her being 34 weeks pregnant? Is that term or is that preterm? So we know bright pink vaginal spotting, preterm, great. Okay, so our 34 weeks pregnant, we know she's preterm. So we don't really want to have a baby yet. We see that she is experiencing mild lower abdominal cramping and small amounts of bright pink vaginal spotting. What do you guys think of that, about that? Mild lower cramping, what could that be? So when we see that we're having cramping, that can indicate signs of labor. And this bright pink vaginal spotting, what do we know about that in labor? So we could have this as the cervix at faces, you have what's called bloody show, and it can cause this bright pink spotting to happen. Now, bleeding in pregnancy is always concerning and could mean many different things. But when we have this cramping, we have bright pink spotting, this is concerning for, yeah, I see preterm labor. Great. So we're concerned about that. Definitely need to look at that further. What do we think about this dyspnea? Are you all concerned at all about the dyspnea that she's having or this headache? When you guys see a headache in pregnancy, what do you automatically think of? You think about preeclampsia. So with preeclampsia, that's that hypertensive disorder that happens in pregnancy, right? And what happens is we have this elevated pressure and it's going to cause a headache. But her blood pressure is looking okay, right? It's 122/81. So I'm not too concerned about that headache. If that blood pressure was elevated, then we'd be worried, yeah, with the proteinuria, all of that. But since she has just a 2 out of 10 headache, her blood pressure's okay, I'm not super concerned about that. Now, she hasn't felt the baby move very much today, and I saw somebody had put that in the chat for a concern. But maybe maybe the baby's been in a deep fetal sleep state, maybe something we need to look at, definitely. But I'm not super concerned about that because maybe she just hasn't noticed the feeling yet, felt the baby move as much. What about in her vital signs? Do we see anything? So she had some dyspnea, so difficulty breathing. But what do we know as that we get further in pregnancy? What happens? That baby grows, takes up space, and our lungs can't expand, right? So we see that she has a slightly elevated respiratory rate, but it's just at 20, so not super, super concerning. And because we know that that baby is just in the way of breathing, it's kind of expected towards the end of pregnancy. We see her temperature looks good, pulse is good. So now we're going to keep all that in mind. We also see that she's 97%. So that makes me feel better about her dyspnea as well, right? Yeah, I see stable vital signs. For the most part, yes, we have stable vital signs.